Necrotizing enterocolitis, or NEC, is a devastating neonatal condition that affects the gastrointestinal system of preterm babies. We know that preterm babies are vulnerable to NEC around the time that they have a blood transfusion, and babies often need blood transfusions during their stay in the intensive care. What we don't know is what we should do with babies' feeds around the time of blood transfusion. Some people think that we should hold babies' feeds, which also affects their nutrition, and other people think that we should continue their feeds, which may or may not predispose them to getting this devastating condition, NEC. The WEET trial stands for Withholding Enteral Feeds Around Transfusion, is trying to answer this question of whether we should hold or continue feeds when our preterm babies are having blood transfusions. So in the trial, some babies will have their feeds continued and other babies will have their feeds held during the time of transfusion, and we will see which is the best in terms of what predisposes babies to getting necrotizing enterocolitis. The WEET trial is a major international study for any problem that affects preterm babies. If it's a rare condition, it takes a huge number of babies to be able to effectively answer the question, thousands of babies. This trial all started here at the Royal, but it's part of a much larger study that will be done in many units across Australia and in fact across the world. The Madison Capaldi Research Fund has been with this trial since the very beginning, and to be honest, I don't think we'd be at this point without their support. It started off as a very small trial, just at the Royal, and on the basis of that, we secured a large amount of funding for a national study, and again, off the back of that, we've been able to get funding for a large international study. And this just wouldn't have been possible with that early groundwork and support from the Madison Capaldi Research Fund.
I'm Charlotte Capaldi, I'm 16 years old. My twin sister Madison and I were born prematurely at 28 weeks, and we spent 7 weeks together here in the newborn intensive care unit. So the Madison Capaldi Research Fund was formed by my parents in memory of my sister who passed away at 7 weeks from necrotizing enterocolitis, or otherwise known as NEC. It means a lot to our family that, knowing that Madison's life was as brief as it was, it still has purpose, and that purpose is for babies who are born in Madison's position to live a more fulfilled and happy life. The Research Raffle has some awesome prizes and the tickets are limited. So the money that will be raised will help Dr. Tim and the rest of the incredible team here at the Royal with their further research into NEC.